I'd like you to watch this video about arthroscopy of the wrist because I'd like you to be fully informed of all the issues that are involved with the surgery, including the issues before the surgery, during the surgery and after the operation. Arthroscopy of the wrist is often a diagnostic procedure, and it's often not designed to make you better, but often gives me more information so that we can plan further surgery. The majority of the arthroscopies that we perform are in this category. We do arthroscopy of the wrist commonly following an injury, and if the pain doesn't settle down for about 3 months, yet the MRI remains normal and the x-rays are all normal, we need to look into the wrist in a bit more detail, and sometimes there are things we can see inside the wrist that we wouldn't be able to see any other way. In many cases, the arthroscopy of the wrist is diagnostic, but sometimes during a diagnostic arthroscopy we can perform minor procedures such as shaving of cartilage or shaving of some of the joint lining. Sometimes we'll put some steroids in during the procedure in order to reduce the discomfort after the procedure. So sometimes wrists will feel better after a more or less diagnostic arthroscopy following a minor procedure. Sometimes we'll move on to a more major reconstruction such as a triangular fibrocartilaginous complex tear. If we put some stitches in during the arthroscopy into the TFCC, as it's called, then we will change the post-operative protocol. So sometimes an arthroscopy of the wrist is therapeutic, and sometimes it's combined with other open procedures, in which case we'll talk about that before the surgery. But we would go ahead with any minor therapeutic procedures if they seemed appropriate. If a more major change to the plan was required, then we would normally have that discussion after the surgery. So when you come into hospital for a wrist arthroscopy, you'll be seen in the usual way on the ward by the nurses and get changed into a theatre gown and go down to the operating theatre. This operation is usually performed under general anaesthetic. When we've performed the surgery, you'll wake up with a light bandage around your wrist, like a tennis sweatband. You go home later the same day, and often the pain following a diagnostic arthroscopy is very minimal. You may need some painkillers after the surgery, but this is uncommon. Following an arthroscopy of the wrist, patients often make rapid progress, and after a few days of swelling, the wounds are dry. You can remove all of the dressings by 72 hours and wash the wounds in normal soap and water. In order to make an optimal recovery, it's important that you elevate the hand and reduce the swelling during the first 24-48 hours. But after this period of time, it's important that you get the hand and wrist moving and that you start returning to normal daily activities to prevent stiffness and weakness in the wrist. So by the time you see me in the clinic at 2 weeks, it should be functioning relatively normally again. People return to work normally at around 48 to 72 hours. You can expect to have at least a day off after surgery, and often if you have the operation performed on a Thursday or a Wednesday, people will return to work on the following Monday. If you're worried about anything after your arthroscopy of the wrist, such as swelling around the wounds or swelling in your wrist or stiffness, then you should call my secretary or call the hospital where the operation was performed, and they'll put you in touch with me as soon as possible.